This is Day in the Life, part of a series of videos showcasing the amazing diversity of health-related jobs. In these interviews, we'll hear a little bit about what a day in the life of a health professional may look like. We will hear perspectives from those frontline healthcare providers that work in a community hospital and rehabilitation hospital. As manager of Sinai Deaf Health, can you please tell me some of the most important things you do on a daily basis?
Yes, my job is to make sure that deaf and hard of hearing people have communication access when they come here. I supervise the interpreter services. I provide in-service training for the staff, doctors, nurses, all the people in the hospital on how to work with deaf and hard of hearing people. I do marketing to the deaf community to let them know about our services here. And finally, I oversee the video remote interpreting, which is technology that allows the doctors to see an interpreter remotely so they can interact with patients anywhere from California to Washington, D.C.
So can you tell me what role you play and contribute to on the healthcare team?
As a deaf person, I believe that my contribution to the team, because I am working with staff, doctors, nurses, they see me as a deaf person, and they have to learn how to work with me, how to communicate with me, and that helps them understand that they can interact more directly and effectively with their deaf patients.
Thank you. Can you tell me on a daily basis what you do as a domestic violence coordinator?
Yes. So the program of domestic violence it's for people with disabilities. So we have a very specific population. So we work with the city of Chicago to help these persons find emergency shelter. I also have answer a hotline. So it's just for emergencies calls. So it's people people with disabilities that might need in need of emergency shelters. They may need transportation, just emotional support. And so the population that I work with, the majority of the abuse comes from their caregivers. It's not only trying to meet their physical needs, but also how do you do safety planning with them and their caregivers if the caregiver is the abuser.
And can you tell me, as part of the healthcare team, what is your contribution?
So as part of the healthcare team, I work with a lot of social workers. I work with other people in other positions that can help me or guide me through and tell me more about resources in order to help domestic violence survivors.
Can you tell me some of the most important things you do on a day-to-day basis as an admissions coordinator?
I do various things, and so one of the most important things is that I make sure that everybody is aware when we get a referral. So a referral come in a hospital, usually they'll fax it or call us in the referral. I make sure that all the documentation has been uploaded and all the responsible parties are aware that the documentations have arrived. So that would be our liaisons, our doctors, and our specialists. So what we'll do is we'll first ensure that the patient is medically stable and a good candidate for our program. Afterwards, we'll check insurance. I'll check Medicares and Medicaids. If it's a little bit more complex insurance like managed care, then the specialist will then take the case and start the pre-certification process to make sure that the insurance will pay for their stay here at the hospital.
Excellent. And can you tell me what role you play on the healthcare team?
Okay, so I make sure that the admissions office is, running efficiently. I make sure that everybody's informed, that we don't have any surprises. Make sure that all the documentations are uploaded, all our I's are dotted, T's are crossed, and just make sure everything's in the right place so we can bring patients into the hospital.
Can you tell me a little bit about your role on the healthcare team as a unit secretary?
As a unit secretary, we answer call lights, we answer phone calls, we put in doctor's orders, we try to meet the patient's needs, try to make sure all their needs in the rooms are met, try to make sure that, you know, we go under the nurse, we follow the nurse's rules, the doctor's rules, and also we make sure that the unit is running smoothly.
Thank you so much for sharing.
You're welcome.